My name is Dr. Lisa Jaacks, and I work at HCA Florida West Women's Health. I specialize in obstetrics and gynecology, as well as urogynecology and reconstructive pelvic surgery. I enjoy the fact that I still see young patients for things as simple as birth control consults, fertility consults, problems with heavy bleeding of their periods and painful periods. But I also see the menopausal patient who's struggling with hot flashes and night sweats. But my complicated patients are typically my patients that are having problems with leaking urine, with coughing and sneezing, or experiencing symptoms of prolapse, pelvic pain, and painful intercourse. So I'm very passionate about urogynecology and pelvic reconstruction surgery in general because these types of disorders tend to be things that patients are initially very embarrassed to discuss. They don't know that there are a large percentage of patients that are dealing with these problems on a daily basis. They just don't talk about them. They feel like they're kind of taboo amongst family, amongst friends, and even amongst just talking to their doctors about this. But fixing these problems, relieving them of the conditions that they're going through can really improve quality of life significantly. And that just brings me such joy to see the look on their face when we can fix a problem like urinary incontinence, a problem like fecal incontinence, a problem like pelvic organ prolapse that they thought maybe they had something terrible that was going on that was life-threatening. To know that it can be fixed and repaired and that they can feel better, it just puts a smile back on their face, and that puts a smile on my face. One of the most rewarding parts of what I do is having patients come back to me and saying, thank you, I've gotten a part of my life back. It's seeing them going out and doing things that they weren't able to do before, but because they feel better, their symptoms are relieved, that they're able to go out and do things that they didn't feel comfortable doing. That's really rewarding.